Hi, my name's Ted Ingalls. I'm the founder of Athena Biomedical. I'm going to spend the next few minutes talking about my company. So, there's a huge problem in the United States, and in fact, all over the world. Last year, 100,000 deaths were attributed to what are called hospital-acquired infections, or infections that patients receive after being admitted to the hospital that they didn't bring with them through the door. These are caused by a variety of different factors. There's catheter-associated infections, ventilator-associated infections, and central line infections, and a variety of organisms that cause them, especially Klebsiella pneumoniae, Pseudomonas aeruginosa, and Clostridium difficile. Now, hospitals spend approximately $30,000, but as much as $60,000 per infection to treat patients that are infected under their watch. And there's a number of factors that are driving the increased expenditure in this area. The first is that all over the world there's an increasingly aging population. This means more people in hospitals and potentially more people that could get sick. Bacteria now are also drug resistant. They've acquired the ability to resist treatment with antibiotics, which means that infections last longer and are more deadly. Lastly, on the financial end, private insurers as well as Medicare and Medicaid are instituting what are called performance improvement plans. Now, what that means is that the worst performing hospitals will see reductions in their insurance payments, and insurers will no longer cover the costs directly associated with treating hospital-acquired infections, since it's seen as a patient safety issue. Now, this is where we come in. A recent body and a growing body of peer-reviewed research indicates that the sinks and the sink drains in ICU rooms is an important source of bacterial outbreaks. And if you think about it, this really makes sense. A lot of other surfaces in the ICU are exquisitely decontaminated. They're exposed to UV light or they're exposed to chemical disinfectants. But the sink receives very minimal attention, despite being one of the only permanently wet sources of contamination in the hospital. A number of studies have been done where sinks have been taken out of ICUs altogether because they were such a huge problem. And there have been 50, 60, and even 70% reduction levels in infections associated with bacteria like Klebsiella and Pseudomonas. So we wanted to come up with a solution that meant people could have their sinks and keep patients safe too. And we want to do this in the simplest and most effective way possible. So we're building a new drain assembly that will fit on any sink in any hospital anywhere in the world. It's composed of two primary bacteria-fighting elements that make it different from other types of drain assemblies. The first is a drain assembly that's made entirely out of copper. Copper has extremely remarkable antimicrobial properties. It's capable of killing any bacteria that touches it in less than 2 hours. And then lastly, what we wanted to do was we wanted to install a series of two different one-way valves. And what this does is prevents bacteria from growing from lower sources in the wastewater system back up into the drain and posing a problem for patients. Because when bacteria climb up these pipes, they eventually reach the top of the drain, where they can spread to a patient's hands, or they can be vaporized into the air and land on a medical device or land on a patient. So we would have two check valves, inline check valves. One that would separate the drain basin from the downpipe, and one that would separate the downpipe from the P-trap. This would mean that bacteria would have to go through two antimicrobial safeguards before they could reach the top, ensuring that patients will never come in contact with the bacteria living in the wastewater. So how do we make money on this model? How are we going to develop the business? So there's three phases that we're actively pursuing right now. The first is what we're in right now, the product development and fundraising phase. We want to build out our minimum viable product and raise enough money to go into this full time and to do this as well as we can. Secondly, we want to do a clinical trial with a neighboring long-term acute care facility in order to demonstrate that our product really works. Lastly, once we have the data that shows the efficacy of our product, we're entering into a co-creation distribution model with a major medical distributor like Medline or Baxter. This way, we can license our technology and not deal with the marketing, distribution, manufacturing headaches normally associated with any kind of medical distribution. So, what are the larger industry trends? First, there's a very strong preference for passive disinfection strategies. So these are things like antimicrobial surfaces or UV lights that simply operate on a timer. It's extremely expensive to have healthcare personnel washing and cleaning things by hand, and so there's a tendency towards self-cleaning surfaces, which is exactly what we're implementing. Hospitals are also increasing their spending on infection control. Direct costs to hospitals last year for hospital-acquired infections were north of $45 billion. It's an absolutely tremendous spending category. And if we can reduce the level of infection at a long-term care facility by only 2% by implementing this intervention, the hospital will make a 3x ROI on their investment. There are also tighter regulations and restrictions from the Joint Commission, from the CDC, who they have to report data to, as well as CMS. So these organizations have never had stricter regulations than they have right now. It's never been harder to comply with patient safety standards than it is right now. So what we're doing is making something that works very well with a minimum of operator intervention. And also, last but not least, hospitals are competing to be above average for patient safety. And so there's fierce inter-hospital competition to meet those metrics. So as far as our competition, there are emergent competitors that we anticipate in the future, but right now only one direct competitor. It's a very small tech licensing company in Germany called Moveo Med, and they have what's called the Moveo siphon. This is an installable siphon that will fit into a sink drain, and it uses ultrasonic cleaning as well as hot water disinfection in order to sterilize bacteria. Now, we don't know the price of this product, but it's extremely complicated. It's expensive. It uses lots and lots of power. Imagine boiling every drop of water that goes through a sink. And so we believe that we can do exactly the same thing with a far, far simpler and more sustainable model. We're going to make sure that we defend our intellectual property through acquiring a provisional and then eventually a utility patent. And we will license our technology through partnerships with medical distributors as well as NDAs. So in closing, I just want to reiterate the fact that real clinical trials have demonstrated how effective sink removal can be in preventing the spread of bacteria. Huge reductions are possible with some of the most important pathogens, especially Pseudomonas and Klebsiella. And the very last thing I want to emphasize is that this product, this company, has the potential to save lives with an incredibly simple technology. It's something that is vastly scalable, understandable, and incredibly, incredibly important. Thank you.